And now, as we extend those arguments to an even grander scale in response to a grand challenge, it gives me great pleasure to introduce the following members on the panel. The panel's name, of course, as you know, from the timetable, how blockchain technology can help to improve the world's health. So we have Mr. Ben Taylor as moderator on the far right from Hyperledger, Amy Hurwitz from Boston Consulting Group, Varvara Russkova from GVA Capital, and last but not least, the grand return of Laure-Helene Caseau from Knomee. So good, we just had to bring her back immediately. So thanks very much, and I'll now pass it over to Mr. Taylor.
Thank you very much, and thanks for joining us today. What we were trying to do by showing you the Grand Challenge Depression is to get you thinking about the more specific elements of how you'd want to drill down on a particular challenge. Obviously, healthcare is a big area, 20% of our economy, and there's a lot of excitement around this due to the privacy issues and other things. And so I'd like to get our panelists to help us think about how they see things going. We're in the very early innings, of course, but what are the opportunities that people see, and how do they look at it? And what I'm going to ask, first of all, is for Amy to talk a little bit. She's at the world-famous consulting firm BCG. How are her clients coming to her asking about blockchain in the healthcare industry, about their perceived opportunities in this area, and what are the things that are bubbling up with the greatest urgency at this point, Amy?
Thank you, Ben. So, like you mentioned, blockchain is an extremely new technology, especially in the applications for healthcare. So this is something that everyone is starting to think about. Conversations are happening all the time as we're seeing huge adoption and applications in different industries. And in the healthcare perspective, when you look across the industry, we have many different sectors. And different perspectives from biopharma, medtech, payers, providers, and there are a ton of different, of course, in healthcare, there's so many different challenges that we're faced with, and they vary across sectors. So as we look at those challenges and we see this new technology, blockchain, the question is, what are the applications that are most compelling? And at the same time, which are the applications that will be able to apply blockchain to most quickly based on where the technology is in its maturity? So what I see so far is in supply chain applications, people are always looking at how can we improve our process and optimize the systems that are already in place. So that's one area where we hear a lot of questions. Another space would be in the biopharma and research space, when there's so much information out there, in order to leverage all the data to draw insights into new potential solutions in the future and new treatments or drugs. How can we pull all the data together and get access to it, potentially using blockchain, in order to then apply maybe artificial intelligence or different algorithms on top of that? And then a third area that I'd say is extremely interesting on the payer-provider side is how can we sort of improve the way that we provide care. So if we, for example, for a single patient, if you go to one healthcare system, you have all of your data in their medical records, for example. You go to a totally different system, maybe you move across country, you don't have access to that data anymore. So how can we solve the problem of interoperability and enable a patient to own their data, and then be able to, as a provider, give them the best care by having a picture of their entire medical history, for example? That would be kind of the holy grail in the medical world, in my perspective. So unfortunately, the technology still needs to be adopted widely in order for that application to be realized. But it's important to think about that early on, and how can we overcome challenges in order to develop the technology so that we can solve these huge problems in healthcare today.
Cool.
So tons of interesting things happening.
Yeah, and I think what's interesting about the whole blockchain thing is that I do think in the healthcare industry, people understand that this is fundamentally different. I was in a meeting in December with Pfizer, Merck, Novartis, and Biogen, and they said it was the first time their lawyers had ever allowed them to meet together to talk about an IT issue. Varvara, can you talk a little bit more about your perspectives as a venture investor in the blockchain and healthcare space globally? As you see the opportunities and as your portfolio companies see the opportunities, would it match up with what Amy's seeing from the provider side and from the pharma side, or do they see the opportunity through a fundamentally different lens?
Okay, my background is not only VC, which is an interesting approach. I'm a former founder myself, VC in the traditional world in San Francisco, and also a crypto fund manager, so investing in crypto projects. So I tend to see everything in healthcare primarily, be that traditional startups or blockchain startups. Emmy's points are correct in terms of different applications, but since we're in the beginning of utilizing blockchain, I would think, what are the areas that are benefiting of this decentralized, very trustworthy system, and how can it impact healthcare overall, be that US or on a global scale? So my excitement on healthcare builds on top of data and prediction on top of this data. So imagine that not only hospitals in the US were able to share this data, but imagine that we could share data without borders for countries. Imagine that we could utilize all this data that we have on ourselves, on all our medical record, on all our instances of getting certain procedure. I saw certain companies that are analyzing population data with very big data sets already and are able to predict which category of people will become chronically ill this year and therefore prevent. Think what it can do on a global scale. Had we had access to all this information, we would be able to tell that your cough today is not necessarily just a simple flu, but we have certain data set for people with same instances that went and had this disease in the end in 2 years. So this can shift healthcare from actually sickness management to sickness prevention, and therefore completely reimagine approach. So that incentives are aligned on keeping us healthy before anything can actually happen. And having this data will be very powerful.
As a follow-up, in your mind, in the venture and startup and entrepreneurial community, does it seem to you that deep learning and AI are going to be important adjuncts to the blockchain revolution? Is that what they're thinking about more?
Yeah, the problem with blockchain, that calculations are decentralized and it takes much longer to do those calculations on the blockchain. And certain solutions can be done without blockchain, with just machine learning. And I saw those startups that initially were pitching me as a blockchain company, and then they were like, well, actually, we can do that with simple machine learning as well. So yeah, blockchain will definitely utilize big data and artificial intelligence to harness all the power of it.
So what I'm hearing, and it isn't really surprising, but it's something just for the audience to reflect on, is that on the entrepreneurial side, people are thinking about the bigger picture 10-year things. And perhaps on the industry side, they're thinking about more tactical things. I remember at the same event I was at in December, the one thing that all the big pharmas agreed on was that blockchain would help them reduce their FedEx bill. And that they felt would have enough ROI to generate, a real interest in their community. And I didn't realize that FedEx bills were that big a deal, but evidently, that's a real pain point for them. And so, Amy, as you're thinking about your companies, and you're trying to help them and guide them through this process of how to set priorities, do you think it's too early yet? Are you pushing them towards pilots? What is it, in fact, that they're thinking about, and how do they reach out to Varvara's community and identify the smaller, newer companies that are going to help them, achieve these goals?
I think the number one, most important thing would be to be aware and to be part of that learning curve and follow what's happening and recognize, and first of all, what are the internal priorities? There have to be, you have to identify a problem before you jump towards a solution. And also have an idea of what maturity level the technology is at. So if you have a key challenge that you're trying to find a solution for and looking out into the world to see what are the potential solutions, awareness of what is blockchain, how does it work, who's using it, and has it been successful, what are the challenges associated with it, is essential in order to be able to identify the right time to act. So as you're learning, and part of that curve, and the whole industry is still, this is very new in healthcare, then you'll be ready to be a first mover or be able to understand what challenges a first mover is addressing when the time is appropriate to adopt blockchain, whether it's through an acquisition or internal development. And part of that learning will be helpful in making the decision about whether it's an internal resource and you want to develop that capability within the company, or if it's that there's examples of the applications that are essential already being developed externally, and partnership or acquisitions in those cases are the most appropriate.
And dumb question, obviously in the fintech area, it seems like a lot of the bigger companies are afraid about being put out of business. In the healthcare community, obviously what we'd all like to see is better outcomes. We'd like to cure things. We'd like for people to have no more depression. But when you're talking about the big companies that are delivering, are they afraid of blockchain putting them out of business? Or do they see it as a helpful adjunct to what they're trying to do?
I guess I see two sides of it. So on one side, there's a key focus on making sure that there's protection of healthcare data, and healthcare is a very sensitive space in not wanting to try something that's super new and then realize later that it didn't work. So healthcare is especially sensitive to that and leads to maybe slower adoption of newer technologies. But then on the other side, in healthcare, something that I really love about the industry is how collaborative we can be. So I think as we're tackling some of these huge challenges that are related to specific disease areas and specific communities, it's really great to see maybe the technology in this case bringing the industry together to be collaborative and think about what the potential solutions could be addressed. And then, of course, develop them either internally, independently, or through these consortia. And we're seeing a lot of consortia starting to form around the idea of blockchain, and small companies who have developed platforms and specific applications that are now being able to interact with the larger companies and consider, okay, is this ready for a pilot? And if so, how do we think about the future in solving a problem with blockchain specifically?
And if I can bring that same question back to you, Varvara, do you get more excited hearing about a startup that wants to put these incumbents out of business and pave them over? Or do you think that this is going to be a space where people are going to make more money selling tools and services and insights to these incumbents and helping them become more efficient and productive?
That's like incumbents and startups. It doesn't matter being incumbents and blockchain solution. It feels for incumbents to innovate is very hard. It's very costly for incumbent to make a big mistake. That's why sometimes it's cheaper just to buy a company that already had it solved. So if I were a startup, I would actually start something really innovative ourselves and then try to take over the world and get all those incumbents out of the picture and let them collaborate after, or try to catch up. I would not necessarily aim at just becoming a part of incumbent, because everything is changing very quickly. And for us to be ahead of it, we gotta be innovating ourselves and actually thinking further. have been thinking, like, what are startups overall? It's like, imagine if Google did everything that Yahoo did, where would they be today? And thinking like that, you gotta think differently from all those incumbents and go ahead and innovate and create and actually dream something that they cannot dream on, and take bigger challenges yourselves and execute and let them see you grow.
Does anybody think that Amy's going to be showing Varvara's clip to her clients this week to scare them a little bit? So if we can then switch over and talk just a little bit more about the provider and the clinical environment and the outcome side, to what extent, Amy, are you thinking that blockchain has some real value in the clinical setting for the sharing of data and outcomes and the sort of things that are going to get us down the path towards the grand challenge that we've sort of highlighted before?
I guess that kind of brings me back to the challenge of interoperability again as well, and sort of especially on the provider side, like in that example of if you live on the East Coast and all of your data is there and you move to the West Coast, like you kind of lose that. You have to bring it to your doctor or start over, and it's very hard to maintain. Almost nobody has a full medical record of their entire life. So as we move towards sort of that cloud, pie in the sky, like ideal world of having, say, people who are born today, maybe as they grow up, will be able to have a full record of all their medical results and data as they grow older. But we're going to have to start with smaller steps. So within a single system, can we show that blockchain works to keep data safe and secure and put the patient in charge of their data? And then if that works, this is the key essential point is going to be that there's collaboration across systems and that there's some common platform that they can use, and that's going to be developed by a third party and get buy-in from different providers. And as that system expands, then patients will be able to have their data stored in one place. So it's going to take a long time for that perfect like pie in the sky scenario to be a reality. But it's something that we need to be thinking about and moving towards, and gradually as people adopt and more companies get on board, then we'll be able to do that with the support of blockchain. So I think key right now is for big companies to keep learning and stay abreast of what's happening, and perhaps be supportive in developing hackathons or bringing people together to think about these ideas and innovate. And for startup companies to really, as you're developing a new application, totally the world is kind of open right now to develop a platform that can be adopted by the big players. So the possibilities are open right now for anyone who has that idea and wants to build it out. There's some really compelling use cases and challenges in healthcare that can be solved that will have a huge impact on how we deliver healthcare and solve the challenges of big diseases today.
And so, Varvara, if I can bring it back to what you're seeing in the investment community and what you're thinking about yourself, is there a sense that there are certain diseases, certain issues that are more pressing than others or more important for the blockchain community? Or is it more a question of finding an area that's underserved geographically? What is it that you think is going to make it people interesting enough to really tackle a project this big?
Trying to rephrase, tackle those certain
yeah, so I mean, are you think it's more likely to be a chronic disease or cancer or diabetes that's going to get people's attention because the money is there? Or is it going to be people who are mobile and don't ever sit in one silo long enough? You know, you take about the itinerant population that we have now, everybody's moving every year.
So I think it's the same question as for any startup. How does one decide what to do? And I think importance is understanding the problem. If you have certain domain expertise, or if you see that certain area is so broken and you understand that everything that exists in this area is not working and you have an idea of how to make it better, that would be probably the area to start with, because I can think of cancer, but I don't know much about it. It's a big problem. I cannot become domain expert within a year. Or maybe you will have a teammate that would be a domain expert and would know that this particular application won't be working. So starting with yourself and starting with passion of yours, because if you're not passionate, you're not going to be spending all your free time on that as well. And startup, as be that blockchain or usual startup, requires really diving deep. I think that's how I understood that I'm happy with what I'm doing and being an investor, is when I found myself late at night reading healthcare reports and reviewing healthcare decks, and that was my relaxing time. So
A little worrying.
yeah, like 11 p.m., 10 p.m., me laying on the carpet, not going to the sofa even. Yeah, so what are you doing in your free time that you're so excited that you become a domain expert? Probably that's what you want to solve yourself, and that is exactly it. And start from there, and understand how does decentralized, trustworthy network empower that solution. So first understanding the problem, and then figuring out what are the tools that you can use to actually tackle this problem. And if it's blockchain, what would be the end application? And if it is certain application, is it easy for people to join it? Because network is everything in blockchain. Without the network effect, how do you actually get the sense out of it? How do you actually get this amount of data? How do you utilize? And the more people are in your network, the better. So asking yourself those questions will help you find out what actually you want to solve and ways to do that.
Thank you. I think that's a perfect segue back to Knomee. Thank you very much. And so on the Knomee front, I wasn't able to, we were getting ready in the ready room, so I didn't get all of this, but just to come back to a thread that you and I were talking about over lunch, Knomee started as a standalone app, and over time, you've decided it's going to be more of a collaborative app. Obviously, blockchain is all about having a communal database for permission sharing, and so the question is, when you think about the collaborations that you would like to enable for Knomee over the coming year or two, how do you think about the various parties, and how would you want to permission these sort of interactions with your doctors, peer counselors? What's the breadth of these things, and what would you like to see?
That's a good summary of where we were. So I mean, as of now, are still not in the cloud, not completely private, everything on the phone, but we really want to move to a collaborative model, because we found out that, and depression is actually the perfect example for this, because so many people face issues of depression, and there's this kind of like big picture view where solutions can work for a lot of people, like medications exist that help countless amount of people, but then there's also a very individualistic aspect to treating it. So when you see your doctor, they're going to first recommend what works for most people, and if it doesn't work, then you'll see the doctor again, and then they'll try the next thing, and the next thing, and the next thing. And so thinking of all these people individually solving their problems, we realized that yes, that was great, and if they're individually helping themselves, wonderful, but how do we take that to a bigger scale? How does this doctor working with this patient, one, start to share data so that they can both, the doctor can have much more interesting information that they can then build on when they're doing their diagnoses and recommendations, and that the patient is more prepared to talk about their own life. But two, how does that doctor not obviously use like actual examples of, but kind of get a big picture of all their patients? How does the medical community learn from all of the data that's being used? How does this, if everyone's collecting data, then it would be great if we can make something that is useful for this next generation or any other person out there. or communities full of people suffering with depression, or however you then use Knomee for.
So as you're thinking about it, we'll have perhaps encrypted data sets that Varvara's portfolio companies could look at a large group of people who are suffering from depression, and they can drill down and look at these encrypted sets, and then potentially use messaging hubs and event hubs that are part of these newer blockchain technologies to message out to people anonymously and ask them questions about their particular affliction and look for personalized solutions.
Yes, definitely. I think it's where blockchain technology would be great for that is with that kind of like piecing and like giving access in parts in an anonymous way to data, so that there's like that possibility of access and going further and things being revealed, but also each patient still owns their data and their privacy is protected.
And to what extent do you believe there's a virality to this situation, and there are common triggering events, so that if UCLA's basketball team loses, then everyone's depressed on campus, or these kinds of things could be more of a situation where looking at a cross-section of a large number of afflicted people, we might learn something about the situation?
I'm not a mental health professional, obviously, but my personal belief is that it's huge. I think that the people you are around impact your lifestyle, they impact your feelings, that I believe there is such a thing as waves of depression that are caused by whatever's going on locally, globally, in the news, what the air pollution is. I think there's so many things that can make a group of people more prone to having issues with their mental health, and I can't even pretend to start to grapple with what those influential aspects could be.
I think we're seeing some of the passion that Varvara is talking about. You guys might have something to talk about after this panel.
It's working, not okay. So, here you go. I have a company in my deal flow right now. I'm helping, not yet investing, just looking how they execute. They're analyzing all the sensors, data, or any other data from other apps in your phone that measure your lifestyle, measure your fitness activity, and actually, with the help of coach, advise you what to improve or what to do with your life, meaning how to just feel better. So there, they notice even incremental changes in your daily routines impact your health tremendously, both mentally and physically. Those are connected, don't discharge one from another. To the extent that they can say, actually, you're walking in the evening for half an hour is not very efficient. If you walk in the morning to your home, to your work for half an hour, and actually take the route that has cleaner air through the parks, that would take a rerouting for like 10 minutes, you will have a better outcome. So the result is that people not only physically more active in the morning, their psychological health is getting up, and just having this tremendous abundant information, you can never predict how impactful it will be, but eventually those personalized recommendations are impacting all sides of your life, and big data harnessing can allow you to figure out what exact routine you need to do to improve your health.
What side of the bed to get out on?
And that kind of brings up an interesting point that I've been thinking about a lot recently, is the trifecta of these three technologies that are emerging right now, and how you gain the ultimate value from blockchain is on one side where every individual kind of is collecting their own data, and that can be linked into the blockchain, where you still have control over your personal information, it's secure, but then it's also coalesced into this location that you can apply algorithms on top of, and that's when you next link with artificial intelligence. So you can have these algorithms and run analyses on this huge data set that's then been amassed to draw insights that can come back to the individuals and give them suggestions on their lifestyles. I think that's an extremely interesting utilization of all three technologies, and I'm really excited to see how they come through in new startups and apply those to our lives and see what happens. There's so many possibilities.
Yeah, I think it's really amazing. And so as people in the pharmaceutical industry think about this, they often use the term real-world data to talk about, you think about it as life, they think about it as real-world data. And so the idea then is that you're getting all sorts of information from all kinds of sources, and obviously you control it. UCLA Medical School is used to controlling the records from your doctor's appointment and providing you with a copy. But now that, as Varvara points out, you've got your Fitbit data, you've seen all these other doctors and caregivers and peer counselors, really the only person who's got access to all the information about you is you. And so the question then is, does this data have value? Do you see that as being something? It seems to be something that's hard to get your mind wrapped around, but in terms of this longer term, is it just valuable to you, or is this something that you really think people are going to be syndicating?
I say it's syndicating because I have this Fitbit, I don't even know what it says. It buzzes when I have message, or when I don't move enough, but it doesn't really give me enough data. So the network effect is something that I personally would love to, and I don't mind sharing, and I want to share as much as I can. If I could to input my 23andMe data, if I could input my meditation data, Fitbit data, all of that together, and if it actually give me something that will make sense by saying, don't run, do more yoga, whatever. I would love that.
That's what that's what Knomee does.
Yeah.
Takes data from, I had a Fitbit for a long time, I just switched to Apple Watch, which is not as good in many ways, but takes information from my Fitbit, takes information from my sleep app, and tells me like which days, like did my yoga in the afternoon have a bigger impact on my feeling, my perceived feeling of well-being, or was it that I actually did eat a salad for lunch every day this week? It can take all these different things and really think about your well-being as a very holistic thing that is triggered by how much coffee you had, but also like, yeah, who you talked to that day, what's going on in the news, all these different things.
Yeah, so every little thing is important.
And so Amy, as you talk to the bigger companies that obviously have franchises to protect, and they're thinking about ways, capitation models and things like that, do you think there's going to be more interest on their part when they're thinking about getting paid by the life to try to, and people are staying on their insurance longer? Do you think you're going to see more good behavior on their part to try to get people's wellness up, or is it not yet something that they're able to get their arms around?
I think it's a huge theme that I'm seeing now is across the industry is this value-based healthcare, and how do we focus on outcomes as opposed to like transacting on providing care. So I think it's definitely a focus across the industry in terms of like what can we do, like Varvara was saying earlier, to focus on prevention and maintaining healthy lifestyles up front, as opposed to focusing on being reactionary when a disease has already happened, and now we have to address that. Because ultimately, it's a lot more expensive to the healthcare system if we get to a point where there's a lot more proliferation of disease and we're having to treat that at the end state, versus investing maybe a bit more upfront than was the case previously in order to encourage healthy behaviors, and ultimately results in a lower cost of healthcare and more engagement with the customers directly. So I think that we see the focus on value applied across the industry when you look at payer provider and like med tech, pharma as well, is just a focus on how do we protect the patient and provide a valuable outcome earlier on.
Fantastic. And
I want to add on quickly that I recently saw a blockchain company that is using insurance approach. Imagine insurance incentivizing you to prevent. Imagine insurance actually reading all this data and creating a data plan that is incentivizing you to be more physically active and taking care of your body and reducing the plan. It's like, can you imagine those closed loop systems in healthcare that will have right incentives in the end to actually have your healthcare, have your health and manage wellness rather than sickness? So anyone building that, I want to talk to you.
yeah, if you think about something like a continuous glucose monitor, and you're hearing more and more about everyday people getting continuous glucose monitors who aren't even diabetic. They're just doing it to manage their mood and their lifestyle and understand what's going on. But imagine if you were an insurance company, you'd certainly like to get that data stream and certainly like to anonymously incentivize somebody to keep their sugar levels at within the band. Those are sort of little things that are a little bit scary for people, but at the same time, if they're properly privileged and anonymized and incentivized, it could be a very powerful model.
Exactly. To your point, it's not something that I've seen yet, but definitely an idea and a use case that I've heard tossed around and kind of played with is, say, and when you think about population health and at the payer level, having an initiative where if you track your blood glucose or your steps, and if you hit certain milestones, then hey, you get a premium or a discount on your healthcare premium for that month or something like that. So these new innovative ways of providing and paying for healthcare, I think would be really exciting to see sometime in the future, but they're currently being developed. So
It would be especially exciting for those of us who try so hard to get our goals anyways.
And when you think about that, as you've talked to your doctor about Knomee and its use, I assume you have.
Oh, yeah.
What's the perspective that you've gotten from the healthcare professionals that you interact with, and how would they like to get that information? Or, is it kind of a one-way street when it comes to, the medical world? They want to use their own data and not yours. I can tell you, Shade, I have a great relationship with my doctor. He's never asked for my Fitbit data.
So during the time I've been working on Knomee, I've actually had two different doctors, which has been kind of interesting two different psychiatrists, because I moved. That's the reason I've had so many doctors. It's nothing against any of the doctors I've had. I just happen to move every year. Exactly what we're referring to, so no continuous care. And my recent doctor is very interested in this idea of, I don't know if she would like to go for the data. I don't think that sounds very exciting to her, but she likes for me to monitor myself more carefully. And she likes the idea that if I'm trying to do this daily, and I have all of this information, then it's just a little bit more trustworthy or reliable than if it's just that day me trying to recount how all this time has gone by. But I think with the doctor I had previously, who was more interested in data, she was the kind of doctor who would have loved to be, she was the one who wanted to give me new quests, who wanted to say, okay, can you actually focus on this now? And to adapt the quest. I think she would be a good candidate down the line to use Knomee with all her patients and adapt there and find that kind of adaptability for some, but also just some general guidelines. Use Knomee as a way to have general guidelines of well-being and health and habits.
Fantastic. I think we're running out of time. Thank you very much for your time and attention. We're going to be here the rest of the afternoon if anyone wants to catch us during breaks. And we're sponsoring a Hackfest with Hyperledger on Tuesday, Wednesday, and Thursday of next week. And I'll see you there if you're going to be hacking with us. Thanks so much.